For a mentally ill person living in a remote area, getting proper treatment is a huge challenge. Unlike physical illness, a patient with severe mental disorder is usually not aware that he or she is suffering from an illness. Not only do they not seek treatment, but in many instances they even resist treatment. So, their treatment depends upon the initiative of family members. Often the community and the family of the patients also have wrong notions regarding the causes of mental illness. They do not accept the problem as a disease, and so they seek solutions from black magic, folk healers, and others. Often the families think that no action is required for such problems and therefore do nothing to solve it. Modern medical practitioners for mental illness, in other words, psychiatrists, are not available at rural or small towns at the taluka levels. Those who are available are in the private sector, where the cost of consultation and medicines are unaffordable to the rural patient. Government mental health services are available at only some of the district level facilities. Also, there is little emphasis on mental health services at the grassroots level in public health sector. All of these factors make access to clinical services nearly impossible for the majority of such patients. Our task, therefore, becomes very challenging. TRU has addressed the lack of availability of mental health services in the Panchmahals with rigor, dedication, and consistency for over a decade. Mental health clinics are now regularly available in 4 talukas: Halol, Kalol, Gogamba, and Jambugoda without any break.
It is important here to remember that these patients face stigma from their own community members, and so it is required that the integration steps must include an important component of general awareness about mental illnesses and its consequences. Secondly, after creating the awareness, it is important to make the community accept that this is also a chronic disease condition and which can be corrected by treatment. Just like several other disease conditions like diabetes mellitus, heart conditions, kidney conditions, etc., this is also a chronic disease and it requires a long-term regular treatment for a patient.
TRU conducts extensive awareness campaigns for those people who believe in black magic. TRU talks about the positive outcomes of rational medical treatment as compared to the quasi-solutions offered by folk healers such as the Badwa, Bhuva, Maharaj, Darga, Temple, etc. We tell the people that they may continue going to folk healers as long as the healer avoids violent, aggressive, and blame-fixing methods. However, they must also continue medical treatment along with these measures. The treatment of a mentally ill patient begins with a visit to the nearby mental health clinic. TRU organizes mental health clinics in the Community Health Center of Gujarat government, popularly known as Referral Hospital in Gogamba. Another center operates out of TRU headquarters in Shivrajpur of Halol Taluka. TRU has designed a specific case note that is issued for each patient the first time he or she visits a mental health clinic. The case note has 2 parts, one to be filled by the doctor and another to be filled by the field workers. The last page of the case note is to be filled by the mental health worker. It contains narration of existing condition of the patient in various areas of life such as chief symptoms, details of the patient's work before and after getting illness, patient's orientation of space, time and persons, the patient's understanding of his or her illness, etc. Once the case note is done at the case counter, the patient is sent to the doctor, the psychiatrist. After taking the patient's history, the psychiatrist prescribes medicines for the patient. The caretaker and the patient are then sent to the clinical psychologist or the senior mental health worker for a session on counseling the caretaker for the patient's disease condition, the need to take timely medicines, sensitization about the patient's specific needs and others. Lastly, the patient and the caretaker visit the medicine counter where the mental health worker not only provides medicines but also conducts appropriate education about the correct dosage of medicines and the need for continuing medicines without a break. Once the patient is done with all of the above, he or she is then issued a case card, which is patient retained. This card contains patient's registration number, name, list of medicines, along with dosage, etc. The back of the card reads general precautions about medicines. The caretaker is told that this card should be carefully retained. If the patient visits other medical facilities for any other illness, then it should be shown there as well. Mental health worker visits the patient's home in the week following the doctor's visit to ensure compliance to the medicine schedule and to make general observations. Often, the caretaker is found to be confused about the dosage of the medicines. In such cases, the mental health worker explains how the medicines should be taken correctly. He or she takes extra precautions when dealing with illiterate or elderly caretakers and often suggests innovative ways of remembering the dosage and giving medicines on time. The mental health worker's help for ensuring correct dosage to the patient helps the caregiver to understand the need for medicines. More than anything else, the individual attention and family visits make the medical service of TRU more accepted in the community.
So if we are able to treat these patients successfully, then they can also live a completely normal life with the full socio-economic potential, and this is a very important aspect to achieve in any community for a patient who was left out from the active life.